Hello, doctor and medical students. I am Dr. Amit. So, whenever you see a patient with hypertension and low potassium level, then think beyond essential hypertension, because hypertension and low potassium is a important or classic clue for hyperaldosteronism. So, hyperaldosteronism should come to your mind as an important differential diagnosis. So today we'll move forward in our endocrine series, and today we'll discuss about hyperaldosteronism. So now let's talk about how to categorize if a patient comes with hypertension and hypokalemia in primary hyperaldosteronism group or secondary hyperaldosteronism groups, or a non-aldosterone cause of hypertension and hypokalemia. So the first step is to check plasma aldosterone level and plasma renin level, because the pattern of these two hormones help us to identify the cause. So let's first talk about the first case. Okay, so if the plasma aldosterone is high and renin is low, then always think of primary hyperaldosteronism. So here the adrenal gland itself is producing excess aldosterone and is independent of renin. So the most common cause of primary hyperaldosteronism is, the first one is aldosterone producing adenoma, and the second one is bilateral adrenal hyperplasia. So whenever you find the plasma aldosterone level is high and renin level is low, then always think of primary hyperaldosteronism. Now let's talk about secondary hyperaldosteronism. So if both the aldosterone level and the renin level are high, if both the levels are high, then always think of secondary hyperaldosteronism. So in this condition, excess renin production is driving the aldosterone secretions. So the most important causes are renovascular hypertension, after then diuretics use, then malignant hypertension, and renin secreting tumor. So just remember that if the plasma aldosterone level is also high and renin level is also high, then always think of secondary cause. Now let's talk about a third, that is non-aldosterone cause. If the both renin and aldosterone level, both levels are low, then always think of non-aldosterone cause. So in this category, the causes include Cushing syndrome, then exogenous mineralocorticoid use, after then congenital adrenal hyperplasia, and deoxycorticoestrone producing adrenal tumors. So let's have a quick revise. So whenever you see a patient with hypertension and low serum potassium, then always think of hyperaldosteronism as one of your differential diagnosis. Primary means aldosterone is high and renin is low. Secondary means both aldosterone and renin is high, and non-aldosterone causes include renin also low and aldosterone also low. So this is important short descriptions about hyperaldosteronism. Thank you for watching. Please subscribe my YouTube channel. Thank you.